Hi everyone, and welcome back to my channel. Today I'm going to be taking you through a quick, simple beginner workout. If you have had a C-section, this is going to help you to start to repair those muscles that have been affected during your surgery. Now, I caveat this by always saying, listen to your body. This is ready for you to start as soon as you feel ready, even if that's in the first few days after your C-section, or if you're a few months or a few years down the line. As always, as a pelvic health physiotherapist, I would always recommend you to go and get your postnatal checkup. This is hands down one of the best investments you can make to get that one-to-one support that you need. As always, do subscribe to my channel, and any questions, add them below. We're going to start in 4-point kneeling. We're going to start by bringing your wrists underneath your shoulders, your knees underneath your hips, and we're going to start with some gentle breathing exercises to help activate and get those tummy muscles switched on. 4-point kneeling is a great position to do that. We love it in clinic and in the gym. So what I want you to do is we'll find your spinal neutral. We're going to start with some gentle pelvic tilts. So we're just going to arch the back ever so slightly, take a nice normal breath in, and then we're just going to breathe out. And we're just going to roll or tuck the hips underneath. And we're just going to focus on the pelvis for now. So it's a breath in, into the belly, breathe out, nice and gently, nice and normal. And then we're just going to tuck. So we're just going to start to get those deep core muscles, which have been cut through during your surgery, as well as your abdominals, those six-pack muscles. We're just going to start to get them working ever so slightly. Now, if your scar or your scar area is feeling sensitive, again, just listen to your body. Go wherever you feel comfortable. Even if that means that you don't feel quite confident yet doing your tilts both ways, just start with one. Okay, we'll come back to the center, and then here we're going to work on some nasal breathing. We love nasal breathing because it's a way to allow your diaphragm, your pelvic floor, and your core, which all work together as a team, to start firing again. So we're going to focus on nasal breathing. Inhale in. When you breathe in, I want you to focus on a 360 breath, so into the lungs and into the belly. And then as you breathe out, you can choose. You can just work on breathing out, drawing the belly button towards the spine, or you can add a pelvic floor in with you because they work together. I like bringing the pelvic floor with me, so it makes it do more than just one thing. And then we're just going to inhale and release. So inhale in, exhale out. Connect to your pelvic floor, draw your belly button in, hold for a second or two, and then on the inhale, we'll just gently release. Inhale in and exhale out. So to connect to your pelvic floor, just squeeze and lift your back passage and your front passage like you're holding in some wind or a wee, and draw that belly button. And you're just going to feel everything starting to tighten up. 2 more. Inhale in, exhale out. Connect to the pelvic floor, draw the belly button in, inhale in to release, exhale out to connect. Nice and easy. And we're doing maybe anywhere between 5 and 6 reps of these, so go with what you feel comfortable with. Okay, we're going to gently release, and then when you're ready, we're going to come down onto our back, and we're going to, again, do some gentle pelvic tilting, same that we've just done in 4-point kneeling. We're going to do in lying. Okay, so hands down by your side, nice and easy. And then when you're ready, we're just going to round, flatten the back down into the floor, and then we're just going to arch the back. Breathe in and breathe out. And again, just rocking forwards and backwards, taking your time. If you feel one position feels a little bit nicer, it's absolutely fine. Stay there. Go with what feels right. Breathe in and breathe out. Last couple. Nice breath in. Nice breath out. And then we're just going to find halfway between those 2 points. So flatten your back against the floor, then arch your back, and then find the middle. And so in this position, again, we're going to work on a little pelvic floor squeeze and a little tummy drawing in. So we're thinking about the pelvic floor at the bottom, the diaphragm at the top, your deep and superficial layer of your tummy muscles and your back. We want them working together. So we'll do a little bit of isolation, what we call isometric exercises. We'll take your breath in, nice normal breath in through the nose. Really breathe into the pelvis, and then as you exhale, we're going to do some gentle pelvic floor. So we'll squeeze and lift the front and the back passage. It should be nice and gentle. You'll notice you're not seeing too much happening. I'm not tilting, I'm not squeezing, I'm not really trying to lift from here. It's a nice gradual contract and relax on each breath. So inhale in, allows you to release and relax. Exhale out, squeeze and lift the back passage. And then you'll notice as you start to lift up towards your head, you feel this gentle area of tightening around the lower abdominals. That's your deep transverse abdominal muscles, and that's what we want to start working. And then as you breathe in, just start to gently let it all go. I like to use my hands. It allows me to really visualize and feel those muscles contracting and relaxing. Inhale in. Exhale out, squeeze and lift, nice and gentle. Draw the belly button towards the spine, nice and gentle. Inhale in, release, relax. Exhale out, squeeze and lift. Inhale in, last couple. Release, relax. Exhale out, squeeze and lift. Last one, inhale in, release and relax. Lovely. Okay, so nice and gently, depending on how comfortable you feel, we're just going to do some gentle lower back knee bends. Great for, again, just starting to mobilize the lower back. You will have been through surgery. Depending on where you are in your journey, that might be quite acute and still feeling a bit uncomfortable, or you might be a little bit further down the line. So just nice and gentle. We're just going to bend the knees to the left, take your head, turn to the right. So you're going away from the knees. And then we're just going to draw the belly button in, bring the knees back to the center, and then change over to the other way. Okay, nice breath in. You'll feel a nice stretch through the cross of the body. And then as you exhale out, again, connect. Draw the belly button in. That allows your core to start to switch on as you start to move back to the center and switch over. Nice breath in. Again, nice belly breath or 360 breath. And then as you exhale, draw the belly button in. Bring the knees back to the center. We're going to do one more either side. And then onto the other position. Inhale in. Nice stretch through the cross of the chest as well. Nice exhale. Draw the belly button in. Come back into the center. One more. And then we'll switch to the other side. Inhale in. Release, relax. Exhale out. Draw the belly button in. Bring yourself back to the center. So take as much time as you need. And then again, thinking about, we're going to connect to the pelvic floor. So we're going to squeeze and lift the front and the back passage, holding in a wee, holding in some wind. We're going to draw the belly button in towards the spine. And then we're just going to hold it, and we're going to bring your right knee up to the hip. So imagine two headlights. You're just going to bring that knee to your headlights and then drop it back down. Now we're just going to add in the breath. So breathe in. As we breathe out, we're going to squeeze and lift the pelvic floor, draw the belly button in. We're going to bring the left knee up to the hip, up to that headlight. We're going to keep it held. Then we're going to drop down. And if you want, sometimes maybe counting 1, 2, 3, 4 feels a lot easier. So as you're just getting to grips and as you're starting, just take your time, okay? One bit at a time. Inhale in. Let's add in the counting. Exhale out. So we'll contract, pelvic floor, draw the belly button in. And then let's try 1, 2, 3, 4. 4, 3, 2, 1. Release by taking your breath in. As you exhale, squeeze and lift, engage the pelvic floor, draw your belly button in towards your spine. Then let's bring that left knee up, counting 1, 2, 3, 4, down, 4, 3, 2, 1. Inhale in, We'll let everything go. Relax. Exhale out. Squeeze and lift the pelvic floor. Gently draw the belly button in towards the spine. Right knee. Let's go. 1, 2, 3, 4. 4, 3, 2, 1. Nice breath in to release. Relax. Exhale, squeeze and lift through the pelvic floor. Draw your belly button in. Left side. 1, 2, 3, 4. 4, 3, 2, 1. Gently release by taking your breath in. As you exhale, one more other side. Let's squeeze and lift the pelvic floor. Front and back passage. Draw the belly button in. Right side. 1, 2, 3, 4. 4, 3, 2, 1. Breath in to release. Breath out to engage. So squeeze and lift, back passage. Gently draw the belly button in. Left side. Last time. 1, 2, 3, 4. 4, 3, 2, 1. And then gently relax. How's that feel? Easy, moderate, or hard? Nice. I always encourage my clients and my patients, less is more. As you're learning technique, as you're trying to integrate the breathing, as you're just trying to feel, are you doing each part correct? And then last one, we're going to turn onto our side. So we're going to get our hips moving now. You can have hands here, or you can be here wherever you like. Your bottom knee closest to the floor is going to come up towards your hip, and then your top leg, we want to make sure that our leg feels straight, okay? So you might have to just bring the heel back just a little bit. We're going to bring your toes up towards your head, chest up nice and tall, and let your hand be supported. So from here, again, we're going to connect, okay? So we're going to get our hip muscles working as well, because they're really important to support, because everything connects into the pelvis. So again, nice and steady. This time we're going to connect, lift up through the pelvic floor, okay? So lift up front and back passage, gently draw the belly button in. We're going to see if we can go for 5. So we'll squeeze the bum, we're going to lift up, nice and controlled, and then we're going to drop down halfway. We're not coming completely to the floor. So again, squeeze, 1, 2, 3, down, 3, 2, 1. And again, count out loud. Up we go. 1, 2, 3, down, 3, 2, 1. And again, 1, 2, 3, down, 3, 2, 1. Nice and steady, nice moderate speed. Make sure if you feel your leg coming forward that you just bring it back so it's nice and straight. 1, 2, 3, down, 3, 2, 1. 1, 2, 3, down, 3, 2, 1. Last one. 1, 2, 3, down, 3, 2, 1. Brilliant. Take your time. Let's switch over. So again, find your position here or here. Bottom knee comes up towards your hip with that top leg nice and straight for me. When you're ready, we're going to connect to the pelvic floor, draw the belly button in, then we'll squeeze the bum, and then up we go. 1, 2, 3, down, 3, 2, 1. 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 Last one. 2, 3, down, 3, 2, 1. These are a group of really simple, really basic, low impact movements that you can start to do after having your C-section. These are safe to do in those early weeks postpartum, and then as you get stronger, we can gradually increase the load and the demand on your body. With everything, it's about technique and taking your time. I hope you enjoyed this video. Of course, please do subscribe to my channel, and I'll see you next time.